We had a very challenging time at the end of August, beginning of September. We had modeled very carefully what we thought was going to happen when the students returned, our undergraduate students. And we were eyes wide open about this. Our goal was to be, very transparent and frank and understanding about all the challenges that their return represented. And we modeled into our data science predictions that not all of them were going to comply with all of the guidelines that we had set out. Again, we were very practical at the end. We wanted to make sure that we knew what we were up against. So, we had modeled that they were probably going to go to parties, and some of them wouldn't wear masks. Or actually, a lot of them wouldn't wear masks and went to parties, even though we asked them to. And it's important that they do so. We also recognized that many of them were coming from all over the state and all over the country, in places where the positivity rates were higher, right, than they were here in Champaign-Urbana. And so we ran the numbers and saw that many of them were going to bring COVID with them, hundreds and hundreds of cases. And so, with all of that, we had a plan. And our plan and our modeling predicted that with the fast, frequent testing, we would be able to mitigate spread of an initial bump that would come in with the students. When they started arriving, and we were, carefully watching the data as the testing was occurring, all of a sudden we got warning signals that something was awry. And I think the key here is that because we were doing the fast, frequent testing, we got those warning signals very early. Our positivity rates started going up before we started even to see dramatic increases in cases. And this gave us a chance to understand the problem and respond, to actually go on offense and do something about it. And because we were collecting so much data and we had such a tremendous partnership with our community partners, including our business leaders, our mayors, the Champaign-Urbana police departments, the university police, and many others who could share information quickly, we quickly learned, and Champaign-Urbana Public Health District, actually probably the most important, we quickly learned what was causing this. And that was that, unfortunately, despite the fact that the overwhelming majority of our students were doing their part and actually showing tremendous leadership, they were rightly proud that their university was being viewed as a model for how to reopen safely. And I want to emphasize that most of them were doing that. The problem was we ended up having a small subset of students who made very bad choices, including knowing they were positive and going to parties, or knowing they were positive for COVID-19 and hosting parties. And this was not in our modeling. And this broke the model. And so we got a spike, and we were able to directly connect the dots back to actual individuals and places where this non-compliance happened. And we saw the effect, okay? So we saw this very dramatic kind of rapid rise. But again, because we had the fast, frequent testing in place, we knew about it early and we could do something about it. And so we were able to respond to that information and make immediate changes that ultimately had a very fast and important effect. So we switched to essential activities only for undergraduates because our data told us that's where the problem was. We also started testing some of our undergraduates more frequently, especially those who were in the highest risk living situations. And the third thing that we did is another challenge we saw was that while we were able to get everybody kind of in the testing program and get the test performed, there was a gap between when the results were available and when individuals were being notified and safely isolated. And so we launched a new team called Shield Team 30 to help get the information of those who test positive as fast as possible to the individuals and then help them get safely isolated, ideally within 30 minutes. And this actually turned out to be a critical pivot. So all those things together, if you look at our dashboard, you can see the spike quickly got reversed, okay? And we've modeled what would have happened if we were not able to respond the way we did. And unfortunately, it predicts that the COVID would have spread wildly across our campus. In contrast, because we went on offense and made changes in a data-driven way, we brought that right back down. And over the course of the next several weeks, we got down to a nice low positivity rate. And over the course of this, next month or so, we ended up dropping progressively and hit 0.05% on a great day in October. And so we were able to leverage the testing in an extraordinary way in real time to mitigate what otherwise would have been a really difficult situation. So I think that was definitely the biggest challenge. And the way in which we responded, I think, gave us a lot of confidence that we were going to be able to move forward in a way that was effective.